Your lifestyle is affecting your fertility more than you think, and it goes beyond just cigarettes and alcohol. Chronic stress can be one of the factors that affects your fertility. It's usually not the only factor, but it can be a contributing factor to infertility. So under or overeating is also something that can affect fertility because your body doesn't prioritize fertility when it's under that kind of stress. It also increases inflammation in the body, which is also a poor environment for implantation to occur. Undiagnosed thyroid disorder can sometimes affect how you ovulate as well as implantation. Endocrine disruptors like plastics and microfibers from your clothing can also interrupt your fertility by disrupting your hormonal environment, and in men especially, they can affect sperm production. Something that's often overlooked is waiting on a partner, such as a male partner who might have fertility issues too. Male age, and then also looking at more detailed sperm analysis, such as a DNA fragmentation in couples who are having unexplained infertility. Sometimes people don't realize certain lubricants can be harmful to sperm, and it can also cause irritation of the vaginal wall, so making sure that you're using sperm and fertility-safe lubricants is important. Endometriosis is often hidden and masked. Not everyone who has endometriosis necessarily has symptoms, but endometriosis can cause infertility through structural blockage of the fallopian tubes as well as through inflammation. People who have poor sleep, maybe due to their job or just in general insomnia, can also be a problem for fertility, partly because of changes to the menstrual cycle, but also because of increased inflammation. Something that's often overlooked is periodontal disease. So having any kind of issues with your teeth is something that you want to make sure you're dealing with while you're trying to conceive, and certainly while you're pregnant. Not only is it a problem for getting pregnant, but it can cause complications during pregnancy as well. So something that can be missed is when women have normal menstrual cycles, they may not think to check whether or not they're ovulating. It's not necessarily true that everyone who has normal menstrual cycles is ovulating. So it's probably worth doing your ovulatory sticks or having some blood tests to confirm whether or not you do ovulate. Sometimes asymptomatic structural issues of the reproductive tract can cause infertility and be unrecognized. So polyps, fibroids, and endometriosis are things that you might want to be screened for. Save this video, and if you have any questions, there's a link in our bio for you to book a consultation.